Technology, sleep apnea, and more coming up. Hi, I'm Allie Cook. Today's October 19th, 2016, and this is your Wednesday Watch. Here's today's dental news brought to you by Dents by Sirona. In one of my personal favorite video interviews from SIROWORLD 2016, Dr. Paul Feuerstein and Dr. Tarun Agarwal sat down to talk about technology and dentistry. Their conversation was too long to fit into today's broadcast, but I do encourage you to check it out online. For now, here's a short clip.
Let's start with the edentulous patient. Here's what we know. Roughly a quarter of our adult population over age 65 is going to be without teeth. Okay, we're living longer, we have a little bit more disposable income, we want a solution. Okay, I believe the general dentists should quarterback cases. Maybe they're not surgically capable of doing the dentistry. Okay, but they need to partner with a surgical specialist, or they can do it themselves. They can leverage technology to plan out the case, know exactly what's going on. And now with digital planning, we know where the teeth are going to be, we know what they want to be, we know how much bone we may need to reduce, we know where the implants are going to go. Suddenly we can start making things that were more complicated, all these components that we used to have, suddenly we can pre-plan.
And you can pre-plan by placing the teeth first.
Yeah, everything's. Listen, at the end of the day, nobody comes to your office saying, "Hey, I want 4 implants." Yeah. Okay, they come saying, "Hey, I want teeth. I want a smile that stays in my head." Right. So the implants are just a method of getting the teeth. Okay. So ultimately, it's about knowing what you're doing, and then eventually, it's like an erector set. Once you plan everything out, it's just doing the process. Right. Okay. Step one, we do the bone, we do the guide, we do the implants, we do the components, we do the teeth. Okay, but it starts from a backwards process, okay, and then it just works great.
That just makes things that work so well. And so what I hear sometimes, and we know I'm kind of leading us on here, but so a dentist says, "Are you kidding me? I have to pay for a CIROC and pay for a Galileo's." Are they paying for that really?
Well, I mean, in a way, sure, it comes out of your bank account, but at the end of the day, listen, these things are lead generation tools, they're production tools, they create revenue, they create things that you weren't doing before. So, but here's the challenging part for dentists to get their heads around. If you want to do fillings and crowns, and that's all you can imagine yourself doing, then maybe 3D imaging is not for you. But if you want to do something more than fillings and crowns, if you want to tap into the potential that's already in your practice, let's think, you asked me about sleep apnea.
Sure.
Okay, I want to use that as an example. And tell me if I'm getting off track here, okay?
You're on your own.
So here's what we know. 1 in 15 adults in the United States suffer from sleep apnea.
Absolutely.
The average practice in this country sees 30 adults a day. Okay.
So you're seeing people with
sleep
apnea.
So there's 2 by mathematics alone. And listen, that's in the skinny part.
Sure.
Like in North Carolina and people like me, there's more than 1 in 15. Okay. So that's 2 people per day in your practice that have sleep apnea. We know that. Multiply that by 200 days a year. That's 400 people in your practice that have sleep apnea. Oof. 400. Average reimbursement for a sleep apnea appliance is $2,500. Okay,
actually, that's maybe where you live.
Yeah, so that's $1 million that's in your practice today.
Wow.
Okay, and
wow.
I would bet I would take a wager that the vast majority of people listening to this are doing between 0 and 5 appliances a year. But yet there's 400 appliances sitting in their practice right now.
To continue the conversation on sleep apnea and dentistry, I spoke with Dr. Scott Pope and asked him how dentists can get started on this important diagnostic process. Again, our whole interview is available online, but for now, here's a brief clip.
It really is. It is. Now for the patients that say do tolerate CPAP, well, then you have the conversation that I understand you have sleep apnea, I understand you have CPAP and it's working great, fantastic. What do you do when you travel? Do you carry that thing with you? Or would you like us to make you an oral appliance that just use when you travel?
That's
use the CPAP
a great
at home.
option.
I mean, it is. It is. So while I'm here at SIROWORLD, what I'm talking about with dentists is we've created a digital workflow with Sirona, CCAT, and CEREC to basically, from start to finish, be able to, 1, co-diagnose with the patient where we see problems, be able to have that conversation, send them back to their primary care physician, their sleep center, or however to get that diagnosis. Once that diagnosis of sleep apnea is made, At that point, we can then have the patient back in our office if they choose to do oral appliance therapy, have them back, take a scan with basically a George gauge that's been preset to where we think is going to be an ideal treatment position for that appliance. And when we take that image with that bite gauge in there, we can then see the changes in that airway. And if that airway is sufficiently open, or if there's still a constriction, we know right away. And we can talk to the patient about that, but it gives us a definitive starting point where we know that we're going to be a lot more successful. Because in the past, treating sleep apnea with an oral appliance, we would have to titrate. And what titration is you're guessing, and you're just going week by week or every other week with the patient, trying to find that sweet spot where that appliance is effective but not uncomfortable for them. Now we can already start in a position that we feel is probably about 80 to 90% in that zone of the sweet spot.
That's great.
And so it's much easier, much less titration with the patient, and I think we're getting much better results too.
Thanks for checking out the Wednesday Watch. Stay tuned next week for more news from SIROWORLD 2016.